Hi, I'm Dr. Phil Durden. I want to welcome you to my practice. Been in dental practice for 20 years. Went to the University of Georgia and graduated with a Bachelor of Science. And went on to Medical College of Georgia and graduated in 1989, the same year that I began practice here in Winterville. My basic treatment philosophy is beautiful, healthy smiles for all ages. We enjoy treating not only the adults, but we love seeing the children too and watching them grow into adults. I love being able to offer someone a convenient place to get all of their treatment done, and I work really hard in expanding my knowledge and my skills in all different facets of dentistry. And this allows me to give the best care possible, keeping all treatment consistent and sequenced in the proper order, having the understanding of how all these things fit together. I think we can provide better care for patients in that way. Besides doing cleanings and fillings and simple crowns like that, we can do full mouth rehabilitations using dental implants, porcelain veneers, and other more complicated procedures that can restore a smile and bring someone's mouth back to full health. Some remarkable new products and technology have really come together to make the enhancement of teeth and gums more feasible and even more affordable for patients today. Everything from lasers to scanners that we can use to actually make impressions of people's teeth, not with the conventional impression materials, but from a camera that just takes a picture of your tooth that we can then manipulate with the computer to make a crown or to make a set of models to use for study. It's just really amazing what some of these newer technologies are doing for us. Some of the x-rays that we have, now we have a CAT scan type x-ray that's available for dental needs, where we can measure the size and shape of bone before placing dental implants, something that we've never had before. Is amazing what it is allowing us to do in pre-planning people's treatments to ensure that we get a better result. One of the things that I have found that makes us unique in the dental industry is that the care that you receive from me and from my team is something that is hard to find anywhere else. The ladies that work here very much are interested in caring for the people they take care of. They'll see to it that you receive the best care possible. They want to make sure that they have a positive influence on the people they're interacting with. And we work really hard in establishing and building trust in patients. It's important to us, and when we gain confidence and trust in our patients, we get to enjoy the reward of a wonderful relationship and sometimes friendships for life. The technical term for TMJ is temporomandibular joint. It basically describes the bones that are in the jaw joint. You have the temporal bone, which is the bone on the side of the face, right where your temples are. And then you have the jaw bone, which is the mandible bone, which is your lower jaw bone. And so you put those two together, you get TMJ, temporomandibular joint. TMJ by itself is really considered to be the great imposter because it comes in so many different varieties. You could have sinus headache, you could have migraine, you could have popping in the jaw, you may even have limited jaw opening. All of these things have been connected to a classic TMJ dysfunction. And because they come in so many varieties and in so many forms, it's sometimes hard and difficult to determine if it really is a TMJ problem that a dentist can treat. The area of treating TMJ dysfunction is a continuing, expanding area of learning for me. So many people have a problem with their jaw joint that is not easily recognized in the medical community. We're also beginning to learn that sometimes The jaw joint is just secondary to something that's even more menacing, and that's obstructive sleep apnea. What obstructive sleep apnea does, besides making us sleepy and drowsy and making us more dangerous while we're driving, it causes us to clench and grind our teeth during sleep, which in turn loads the jaw joint, and when the jaw joint gets loaded, it wears itself out. The muscles get sore, the tendons get sore, and you get your classic T&J problem with that. I want the people that we treat to feel comfortable, and I want them to not be afraid of the dentist. The majority of people are fearful to some degree or another, and if I can overcome their fear and help them get back a smile that they've lost, or repair a tooth that's hurting them, or replace a missing tooth that bothers how they feel about themselves, that's where I get my joy in providing that kind of care.